Good morning. I would like to start off by saying thank you to the Senate for having us here today. We are really looking forward to sharing with you a little bit about Memorial Community Hospital. To start off, Memorial Community Hospital is located in a small rural town where the main sources of jobs are farming and agriculture. And there are good parts to living in this friendly, slow paced environment, but with living in this environment, there are also some challenges too. The members of the community have lower levels of education and therefore are not as health literate as you would like them to be. Therefore, they tend to have less healthy lifestyles that they live. By taking all of this into account, we've created our mission. We care, our culture is contagious, and we are resourceful. We care because we focus on providing care for those that are government or uninsured because we really prioritize helping out the underserved community. Our culture is contagious because we want to make sure that all our patients feel valued and not just another person coming in for the day. And lastly, we are resourceful because we make do with what we have. We don't spend a bunch of money on fancy new equipment if we have it where we can get it used from somewhere, and we don't have a high income of money because we don't live in as wealthy of a community. So we don't get large donations or anything like that. In conclusion, our vision statement is as follows. Memorial Community Hospital will be the standard of rural care through improving services for the community by enhancing relationships with patients through expanding skilled personnel, creating outreach programs, and better utilizing available resources for superior care, while continuing to keep costs affordable and patient satisfaction high. Thank you.
As MCH's leadership team, we have looked at our budget and made 3 different forecasted budget cuts at 5, 10, and 15%. With budget cuts comes implications which we have evaluated and weighed against the needs of our patient population. MCH is the largest hospital in the area, and we have 2 rural health clinics that serve a population who would otherwise have to drive 50 miles to the closest health facility to receive care. Due to this, we are in need of additional funding to effectively and efficiently serve our patient population. Without this funding, MCH will have to make large cuts, such as letting go of department managers and reducing employee benefits and professional fees. Consequently, reducing our leadership team, decreasing our healthcare team and their morale, and creating a need of reorganization. Therefore, employees would need to take on more roles. These are relatively small cuts with large implications. Say these previously mentioned cuts are not enough. We would also have to close one of our 2 rural health clinics we have under the MCH umbrella. This would reduce our patients' access to care and would create more job loss. With monetary assistance from the state, we at MCH would be able to continue to care for our rural population's health needs. Thank you.
Memorial Community Hospital has many strengths that benefit the community of Keene County. We are a rural hospital that helps to teach and provide for our older population. Since our predominant population are people who are older with lower healthy lifestyles and lower education, this hospital has become a place to educate as well as treat. With Keene being such a family-oriented community, our staff takes great pride in caring for the patients. The culture around the hospital is like a second home, and we are good at making patients feel like they are people, not just numbers. Patients are our main priority, so we have a policy set in place that all of our staff must receive vaccinations before working with any of the patients. This is not only to keep the patients safe, but also to keep our staff from spreading anything outside of the hospital into the community. This is just one example of the policies that Memorial Community Hospital has that not only help the people within the hospital, but to keep the community safe as well. This funding would help keep our clinics and hospitals running smoothly, without a cutback, so we can continue to teach and treat the community of Keene County effectively.
Thanks, Colby. While continuing to teach and treat the Keene community, the administrators of Memorial Community Hospital are working hard to inspire and demonstrate the shared goals and standards we have for our colleagues. Administrators strive to be leaders employees can admire and encourage working as a team in order to accomplish these shared mission and goals. Using Kuz's and Posner's leadership framework, our administrators and executives are inspiring collective goals in employees while enabling others to take action and modeling those policies and values. This was effectively demonstrated when we enacted a new policy Colby spoke about regarding mandatory vaccines for all employees. The administration addressed the beneficial reasons for this new policy and challenged the aspects of the old policy, lacking in health prevention and promotion, that were inhibiting our vision. The standards and goals we have all represent a common mission for improving and promoting the health of the Keene community. Leadership styles focus on promoting teamwork, inspiring employees to meet the standards, and representing the values of Memorial Community Hospital respectively and properly. We hope to make our patients feel valued and our employees feel like family. Here at Memorial Community Hospital, we care, our culture is contagious, we are resourceful, and we will be the standard of rural health care. From everyone in Keene, I want to thank you for your time.